you, Chair, and thank you, Vice President Chen, for sharing your experiences of Taiwan with us. I wondered whether the experiences of the SARS epidemic in 2003 has influenced your approach to this pandemic, and also whether you have any frustrations that countries around the world are not necessarily following best practice from you and others, whether there should be better mechanisms in place and whether too many are trying to reinvent the wheel when it comes to creating apps, for instance. Thank you.
Okay. In the SARS outbreak dating back in year 2003, indeed we found that there's a lot of inadequacy for us to control the outbreak very well. This including this our organization of Ministry of Health, as well as this our CDC, and we have inadequacy of this infectious disease and physicians and so forth. So after the SARS outbreak, we have all this Infection Control Act amended and reorganization of our health ministry as well as CDC and healthcare system and hospital infection control. So I think there's all these efforts help us to do this good pandemic control for COVID-19 this year. But I think that more importantly is that I want to emphasize that different countries should adopt different strategies according to your situation. But still, there's a cooperation of those people. It definitely is very important. And the compliance of the Taiwanese people with regard to this home quarantine and maintain this good health behavior, including wearing this face mask and washing hands with soap frequently, and have stringent this sick leave. Don't go to this work or go to school when you are sick. I think this people here are compliant quite good. So, well, that's the situation in Taiwan. And we learned from the difficulties and the disasters in year 2003. And maybe this is the reason why people in Taiwan are much more willing to help the government to control this COVID-19 in Taiwan this year.